Margaret Chan, you're just out of your meeting with Premier Li Keqiang. Did you congratulate him on China's vaccine passing your assessment, or did you push him on the health reforms yet to be achieved?
Vaccine is a very important component to support the healthcare reform. So we did talk about the importance of bringing together the assets from different ministries in this government to support the healthcare reform. And well, I think, China, if they can really produce quality, affordable medicines, especially generic medicines, not only do they benefit their own people, they could benefit the rest of the world.
You've been very active in the last weeks on Chinese social media, and you've personally been calling for an increase in tobacco taxes that you say will simply help save lives. But my question is this: what's the evidence for a country where a packet of cigarettes costs from as little as $1?
In China, every year 1 million Chinese die from tobacco-related diseases. And this number is going to rise to 3 million in the next 10, 20 years. So it is in the interest of the Chinese government, and also in keeping with the healthcare reform, to gear up on the prevention, to reduce tobacco demand, to make it expensive for people to buy tobacco. So increasing tobacco tax is very effective.
Well, I'm not sure how big of a football fan you are, but Sunday, of course, is the final of the World Cup, and major sports events throw up so many opportunities for brands that advertise heavily, brands that represent fast food, soft drinks, and of course, alcohol. When millions or billions of dollars are being spent in this direction, what's the capacity of the WHO to fight off these so-called profit-driven diseases?
We do need to eat. We do need to drink. Tobacco, we don't need to smoke. Now, and that's why countries in the World Health Organization is very strong in terms of tobacco control, because this is in contradiction of promoting sports, which is good for activities, good for building your body. So, of course, governments come under different pressures. Financial pressures, marketing pressures. So it's not an easy decision to take. But I begin to see more and more countries refusing to accept sponsorship.
Well, I remember this very well. 11 years ago, you were right on the front lines in the global response to SARS. And the big worry at that time was the threat of emerging new diseases. 11 years later, with TB, for example, do you think that the bigger concern for you is the re-emergence of old diseases?
When you're doing well, oftentimes in public health, complacency sets in. And then when you get relaxed, the microbes will come back with a vengeance. And what is even more worrying is we are going to see drug resistance, tuberculosis, more in more countries, including in China. And if indeed tuberculosis is coming back in another form, where the first line of medicine is no longer effective, you have to pay much more to get the second line medicine. It's not just a matter of cost. The second line medicine gives you more complications, and it can cause more side effects.
If you pick up a copy of Forbes magazine, you'll know that you're officially now the 30th most powerful woman in the world today, and you're above Arianna Huffington, you're above Angelina Jolie, and you're even above the Queen. When you were first elected to the head of the WHO, you made a very personal promise then to improve the health of women all over the world. Now when you think about it though, and you think about that vision inside your head, inside your heart, how close are you to achieving that for all your global sisters?
I continue to champion for improving the social status of women, improving education for women, particularly girls, and empower women. And then when you give them the knowledge, give them the education, women do know how to take care of themselves. And I have to say, in the last 7 years, I'm beginning to see even the most stubborn statistics, which is maternal mortality, has dropped from about 500,000 deaths per year to about 280,000. That is still 280,000 too many. So we need to continue with our fight, and to fight for the gender equity, to fight for the social participation of women, education, and all the rest. And all these will come about.
We've been talking about vision, policy, architecture, but I want to finish off with dreams. The Chinese president is now so well known for what he calls the Chinese dream, but I hear that you've been telling the president, even the premier, about your Chinese dreams. So share a little bit about that.
When I retire, I hope to be able to settle down in China, in a city within the community where I have a well-trained, well-qualified family doctor, or in some cases they call it general practitioner, to take care of my health care. 95% of the health problems can be dealt with at the community level by well-trained family doctors.
Well, we hope that in those 3 or 5 years to come that we can speak to you again in your home and meet that doctor, man or woman that he may be with. Thank you very much, Margaret Chan.
Thank you, James. So nice to see you again.